Welcome back guys. Now let's discuss about bile. Question number 1. Who produces the bile? Students will say gallbladder. No, gallbladder is not the site of bile production, it's the liver. So in liver, bile is produced. How much bile is produced every day? Almost 500 ml every day. 500 ml per day. Almost a half a liter of bile is produced every day. And what exactly bile contains? So bile is helping in the digestion of the fats, right? So bile contains which enzymes? Is it the amylases, proteases or lipases? What do you think? Lipases? Answer is no. First of all, bile doesn't contain any enzymes at all. Bile itself, see, bile does not have any digestive enzymes. Bile contains no enzymes. Okay, you have to know this. Then what is there in the bile? Bile composition. Bile contains bile acids. Bile acids, you will study about them in biochemistry. What are the different types of bile acids? Bile acids, bile salts. Okay, bile acids, bile salts. See, these bile acids, bile salts, they are derivatives of what? They are derivatives of cholesterol. Okay, they are made from the cholesterol, guys. They are nothing but the cholesterol. Okay, what they will do, we will see later. But bile acids, bile salts themselves, they are nothing but cholesterol. They came from the cholesterol. Next, bile pigments. Bile pigments. So what exactly are these bile pigments like bilirubin, biliverdin? They are the metabolites, or they are the waste products of the heme metabolism. Okay, once the RBCs are destroyed after 120 days, the heme, whatever is there, that will be broken down. So the waste products of the heme metabolism will become bile pigments like bilirubin, biliverdin. They will be excreted out through the GIT, through the bile. Next, so that's the reason why here I have given. So bile also plays an important role in the excretion of bile pigments. What are bile pigments? Bile pigments are nothing but the products of heme metabolism. Okay, after 120 days, RBCs are going to be destroyed. The RBC degradation products are nothing but the bile pigments, guys. Okay, which are waste. We don't have they don't have any importance. Next, anything else is present in the bile? Bile contains cholesterol. Bile contains water and some electrolytes. Okay, bile also contains electrolytes. So these are the important things that are present in the bile, but bile itself doesn't contain any enzymes. Then students will have it out. So then what is the function of the bile? See, the fats that you are eating, they are more complex molecules. Okay, the fats are more complex molecules. You have to break down these fats into much simpler molecules. So these bile salts especially, okay, the bile acids and bile salts, what they will do? This bile salt, look here, what it is doing, it's converting a large lipid molecule, a large fat globule into the smaller molecules. So this process is called as emulsification. So the conversion of a large lipid droplets into the smaller droplets, making them more simple so that the digestion will be easy. The lipases can act and the digestion can become easy. So what is the emulsification process? Emulsification process means, see, bile converts a large lipid molecules into smaller droplets. This process is called as emulsification. Okay, this process is called as what? Emulsification. Done. Next step. Let's see what happens once the emulsification happens. Guys, today, let's say you are eating fats. We all know once you are eating fats, once the fats comes to the duodenum, fats are going to stimulate which cells? Fats are going to stimulate the eye cells. I have taught you, eye cells are going to produce cholecystokinin. What the cholecystokinin will do? Cholecystokinin will go and cause the contraction of the gallbladder. So gallbladder is a place where bile is stored, you know. So now gallbladder is getting contracted. Now gallbladder is going to release the bile acids and bile salts. So today bile acids, bile salts are released. Bile acids will do the, bile acids and bile salts, what they will do? They will help in the process of the emulsification and done. Now what you are left with is the bile acids. Now see, we are not going to lose these bile acids. Okay, whatever the bile acids are present over here, we are not going to lose them. See, the bile acids will go from duodenum, jejunum, and in the ileum region, highlight here important ileum. In the ileum region, we are going to reabsorb these bile acids. The bile acids are again reabsorbed into the blood, and through the blood, these bile acids, see where they are coming? They are coming back to the liver. So the bile acids are recycled again, they are coming back to the liver, and again we use these bile acids again. So what I am trying to say, from the intestines back to the liver. From the intestines back to the liver. So this reuptake is called as entero means intestine, hepatic means liver. So this blood supply is called as the enterohepatic circulation, or you can say bile acids are reabsorbed via the enterohepatic circulation or the portal circulation. This is nothing but the portal circulation, guys. So there is enterohepatic reuptake of the bile acids. Okay, fine. So right, bile acids are reabsorbed. We are not going to lose them. Where? Via enterohepatic circulation. Okay, fine. Why you should know this? Two MCQs are there. MCQ number 1, bile acids are reabsorbed in ileum region. Okay, bile acids Where they are reabsorbed? In the ileum. Previously also here in this topic I have explained you where the bile acids are getting reabsorbed. Along with the vitamin B12, the bile acids are reabsorbed in ileum region. You already know it. But right now, look carefully. Guys, today you are going to use a drug. Let's say here is that X drug, this black color drug which is coming and binding with the bile acid. Okay, there is a drug. What this drug is doing? It's coming and binding with the bile acids. In the presence of this drug, the absorption is going to be inhibited. The bile acid absorption in the ileum region is stopped. So, what are these drugs called as? First of all, these drugs are called as a BABA drugs, BA, that is bile acid binding agent. Bile acid binding agent. These drugs, they will go and bind with the bile acids, bile acid binding agent. What they are doing? These bile acid binding agent, they are inhibiting the enterohepatic reuptake of this bile acid. Stop. So tell me, today the bile acids are reabsorbed? No. Where these bile acids are going today? Now in the presence of BABA drugs, the bile acids, they are going into the feces. The bile acids are lost in feces, gone. So bile acid loss means cholesterol loss. I have told you bile acids are nothing but the cholesterol. Now every day you are losing, the bile acids out of your body. If you are losing the bile acids, it's nothing but you are losing the cholesterol. The body have to produce the new bile acid from the cholesterol, again loss. Body is using cholesterol to produce the bile acid, again loss. Okay, liver is producing the bile acid from the cholesterol, again loss. So every day if you are losing the bile acids, it means loss of cholesterol. It's equal to loss of cholesterol. So now tell me, if you use BABA drugs, what happened to the cholesterol? You are losing the cholesterol out of the body. So what happened to your cholesterol levels? Decreases. So these BABA drugs can decrease your overall cholesterol levels. So now tell me, BABA drugs are used in the treatment of which condition? The BABA drugs, look at here, these are the BABA drugs. Drugs like cholestyramine, cholestyramine, colcivalam. What are they? They are BABA drugs. What do they inhibit? BABA drugs inhibit these BABA drugs, cholestyramine, cholestyramine and cholestyramine. These drugs, they will inhibit enterohepatic reuptake. They inhibit enterohepatic reuptake process, guys. Okay, done. Next, so these drugs are used in the treatment of which condition, guys? They are used in the treatment of hypercholesterolemia. So they are used in the treatment of hypercholesterolemia. So if the person is having high levels of cholesterol, imagine I am the person who is having high levels of cholesterol. So by using these BABA drugs, you can decrease my cholesterol levels. Okay, so BABA drugs are used in the treatment of hypercholesterolemia, especially in children and pregnants. So what are the safe drugs to decrease the cholesterol levels in the pregnancy? The drug of choice for hypercholesterolemia in the children and the pregnant females are BABA drugs, cholestyramine, cholestyramine, colcivalam. BABA drugs inhibit the reabsorption of the bile acids from the ileum region. Bile acids are absorbed in ileum with the help of enterohepatic circulation. Okay. Next, anything that you have to know regarding the bile. Guys, look at this term. Some terms are important. What exactly is a cholegog? Cholegog means the substance which causes the gallbladder contraction. So who is that cholegog, the one who causes the gallbladder contraction? It's a cholecystokinin. So cholecystokinin is a hormone which is causing the gallbladder contraction and helps in bile release. So it's causing bile release. So what exactly is a cholegog? The one who causes the gallbladder contraction and who helps in bile release. So that substance is called as a cholecystokinin, and you know cholecystokinin is produced from the eye cells. Okay, whenever the fat stimulate the eye cells, cholecystokinin is released. And then what exactly is a cholerectic? Which substances are called as a cholerectic? The one which increases the bile production, are called as a cholerectic. Okay, what are they? Hormones like secretin and parasympathetic nervous system, or you can say the vagus. Okay, the vagal stimulation can increase the bile production. So the one who produces the bile is called as a cholerectic, and the one who increases the bile release is called as a cholegog. Cholegog is very, very important for your exam. So with this, what we have completed? We have completed the topic of bile. All important points about the bile. Hope the video is helpful. Thank you.